Hello guys, today we will talk about an app which is named Full Court Medical Stimulation, and there's a scenario in your screen which is a 29-year-old man which has complaint of abdominal pain and nausea from 2-3 days. So we will start by talking. So this is a AI model in which you can do conversation with your patient. So patient has abdominal pain and nausea. So we will ask some questions. We will first reassure the patient, and we will ask about other symptoms or complaints. So this is the AI, so he will give you answers. So he has abdominal pain and nausea, and patient also has a vomiting episode of vomiting now recently. So we will ask that which part of the abdomen hurting. So middle and right side. So we will ask about is there any radiating factor, because in some cases like in pancreatitis the pain is radiated to the back. So okay, so it is just a localized pain. So we will go for the examination, and we just firstly reassure the patient. Okay, the pain is getting worse. It means he has a very severe pain. So we'll quickly go for the examination. So there is a portion in which you can perform all the examination. So just click on exam, and you see there is a lots of examination you can perform. So you perform abdominal examination first. So it shows a soft right lower quadrant tenderness with mild girding, no rebound, right sided pain with palpitation on the left lower quadrant, bowel sound are audible. So we will look for other cardiovascular examination. So it says tachycardic and no abnormal sound. The pulmonary examination is also normal, no abnormal lung sound. So in an abdominal examination, there is a right-sided pain with palpation of left lower quadrant, bowel sound, and genitourinary examination is also normal. Okay, so we go for the stabilization portion. We will attach monitor. So you will see that only heart rate is his patient is tachycardic. All other vitals are normal. So we will give you a fluid, normal saline 500 ml. So firstly we will get a vascular access. We insert IV and get vascular access. Then we administer normal saline. So you will see there is a nurse which is also giving information about the patient condition. If patient has any complaint, then you know. So this is a scenario in which how you can manage patient in emergency condition, and it's very good for examination like PLAB 2. So we'll go for the differential portion, and you see we'll go for gastrointestinal. And okay, the first differential diagnosis which I'm suspecting, the patient might have acute gastroenteritis, because patient has abdominal pain, vomiting. We can ask other symptoms like food poisoning. And this differential diagnosis I'm suspecting is appendicitis, because the patient has lower abdominal pain, right lower abdominal pain, and also the patient has severe pain. Okay, I don't think this is a cholangitis, because patient in cholangitis we have upper abdominal pain. Okay, so in gastroesophageal reflux disease, the patient has usually upper abdominal pain and lower chest pain. So for up till now, based on history, I have two differential diagnoses: acute gastroenteritis and appendicitis. Okay. So now we will go for the investigation portion. We quickly investigate. We will start with some. So in this side you can do any test. You have bad side test. You have imagining test. You have other tests also available. So we will go for the CBC. Okay. Okay, here we got the result. So patient white blood count is raised. The normal value of is 3.2 to 9.8, and patient hematocrit ratio is also increased. The normal range is 0.4 to 0.52. Hematocrit ratio is usually increased in dehydration. The patient is dehydrated. We already give 500 ml normal saline, so he's good to go. We can also give antibiotic. Okay, so we will give ondansetron because patient has a complaint of nausea and also have one episode of vomiting recently. So it is an anti-emetic drug which is given for nausea and vomiting. It came a brand name of Onset in market. The dose is 8 mg adult dose IV, and tablet dose is also 8 mg. And also we will for the proton pump inhibitor for abdominal pain. It came is a brand name of Ryzik. The dose is capsule Ryzik 40 mg OD once a day. And this is a famotidine, which is a H2 histamine blocker. So we will give PPI. Okay. Some suprazole bolus given. Okay. Then I will go for the imagining test. I will prepare CT abdomen. CT abdomen to rule out the diverticulitis, appendicitis, which is our differential diagnosis, and also we can rule out diverticulitis, cholecystitis, pancreatitis. Patient has no radiant factor, so it means there is no. Okay, so we can communicate with specialists through this app. So the gastroenterologist said that careful abdominal examination to look for the peritoneal sign. Okay, so then we will go give the review for general surgeon. Okay, so the general surgeon said based upon CT scan it is appendicitis, and he is recommending ready the patient in a pre-op area. Okay, so it is appendicitis. So ready for patient for pre-op, for operating room and differential diagnosis of appendicitis. So first we will be do counseling of patient and reassure the patient and take consent for surgery. Okay, so the patient still has pain, so we will give the H2 receptor blocker, famotidine, H2 histamine blocker. Okay. So first we reassure the patient. Okay, the patient. Alright, we have gave you the medication. Okay, now we will told him about her diagnosis of appendicitis about the CT abdomen finding. Okay, let's show that you have appendicitis, which is basically an inflammation of appendix. Okay, the patient is curious to ask the next step, so we will tell about the general surgeon opinion and take concern for the appendectomy procedure, which is basically a removal of appendix.
Dr. Bevelich, please report stat to room 10. Dr. Bevelich to room 10.
Okay, so patient is asking when will the surgery be. So okay, we will shift in operating theater now.
Calisthenics, cath lab activation. Calisthenics, cath
But first we need a consent. We need your consent. Okay, you see the patient, you can talk to patient, you can ask the history, you can counsel, you can reassure. So this app is really help in your exam like PLAB 2, the OSCE base exam. And you will get a rare scenario. Okay, the patient wants to start surgery. Okay, fine. Okay, then we'll be in a hands-on position. We will prepare for operating room and the definite diagnosis is appendicitis, and in the end we will finish our case. The score I get is 76.4. The diagnosis is correct, and you see, so you can unlock. This is a full code medical stimulation. You will get 188 cases. So the 4 cases are free. The one case which I did, and another case word finding difficulty, gunshot wound in the neck, found lethargic by roommates. These 4 tests are free. For 188 other tests, you have to pay. You have to get a subscription. Also, you can I think so. You can do there's the option of random case. I think these are for free, so you can do. There are many variety of cases: fever, palpitation, abdominal pain, lethargic, bite, bee sting, neck pain, MI, altered mental state, ALOC. So these all tests you can perform. You can search by the category. You can also search by the complaint of patient. So this is a very wonderful app. You can easily get this app through Play Store. It is available in Apple and also for Android user. Okay, thank you so much.